Is this being used in the spine as well?
Yes. So the application of the spinal robot is still more limited than what you experienced with the robot that goes into the belly.
Right, because you can't even compare these apples to oranges here.
It's true.
The spine is much more severe.
Well, I wouldn't even say that. It's just we are still sort of entering the field of robotics in spine.
I see.
Whereas the robot that's used for prostatectomies, for hysterectomy, that has really gotten to a very good point in technology, a very safe point. So in spine surgery, the robot is used for placement of instrumentation, and it has really maximized the accuracy, which in itself is an issue because in spine surgery, 99% precision still leaves 1% that is not perfect.
Okay.
So battling for that 1% is essential.
It is, and 1% is a lot when it comes to surgery.
Exactly.
So since it's a relatively new technique when it comes to the spine, as opposed to other fields that you were talking about, what kind of procedures does robotics help with right now?
Fusion surgery.
Fusion surgery, okay. So what is fusion, if you could explain that to us, Doctor?
Sure. So with time, certain spinal conditions result in loss of stability or deformity. And as an orthopedic spine surgeon, a lot of what I do is fixing deformity. Well, human spine is kind of like a tree. You can hold it up, and in order to keep it there, you have to secure it in place. That's done with screws. Now, classically, the screws were placed through a big, wide open incision after significant muscle injury. And through a number of steps, we've now gotten to the point where screws can be placed through a little percutaneous incision, something very small, with ultimate precision, without having to injure the skin and injure the muscles, using a preoperative CT scan. So the computer gets its knowledge about the patient's anatomy from a CT scan, and we pre-plan the placement of the hardware before the patient is even asleep. And once the patient is asleep, we minimize that time under, and we maximize the precision of placement of the hardware.